Hey there, NCLEX warriors. Welcome back to another session to help you crush the next generation NCLEX-RN. So today we're tackling some challenging questions that will sharpen your test-taking skills and boost your confidence. And so we will break down the answers with rationals and some pro test-taking tips to help you stay calm and focused on the exam day. Whether it's prioritizing care or spotting complications, we're here to get you one step closer to that RN title. So jump in, take some notes, and ace these questions. Now, if you love this content, be sure to like and subscribe to this video and for more NCLEX prep goodness.
Before moving ahead, I have some exciting news for you. If you are determined to pass the NCLEX within a week or a month, then your best option is to enroll in our complete online NCLEX review crash course right now. This course is a comprehensive all-in-one solution, a guaranteed shortcut, and a proven method to pass. Over the last 5 years, more than 5,000 students have successfully cleared their NCLEX exams using this course with an impressive 99% passing rate. Here's what you'll get: 100-hour animated mini crash course, ideal for those who have limited time and want to pass in just 1 week. 300-hour comprehensive recorded lectures covering 300 high-yield NCLEX topics that the exam loves to test. 5,000 real NCLEX questions, practice with actual past exam questions for better preparation. 15 full-length practice tests, including CAT simulation. Feel confident before your real exam day. Exclusive NCLEX ebook, the ultimate guide you need to pass. 1 year full access. Study anytime, anywhere at your own pace. This is a limited time offer. Enroll now to grab 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. All right, now let's dive into the topic.
Let's have our first case. A 62-year-old patient underwent a planned open reduction and internal fixation, or ORIF, of the right ankle earlier today after recovering in the PACU. The patient was moved to a ward for ongoing observation. The patient was receiving an IV infusion of 5% dextrose in normal saline at 100 mL per hour and has a thick surgical dressing with a posterior splint covering the right ankle, extending from the heel up to the knee. And current vital signs include a blood pressure of 130/80 mmHg, heart rate of 88 beats per minute, respiratory rate of 16 breaths per minute, and temperature of 37.1 degrees centigrade or 98.8 degrees Fahrenheit. Your task is to determine whether each is indicated or contraindicated or non-essential for the patient's current care. So you have here a matrix style of test item. So you have here a group of nursing actions in the first column. Second column will give you an option to mark if it is indicated or contraindicated in the third column, or non-essential for the fourth column. Now let's take a look into the first nursing action. It says monitor the levels of oxygen saturation. The answer to this is indicated. And why is that? It's because the patient is post-surgical and has a stable vital signs, but monitoring oxygen saturation is standard practice after any surgery to detect any respiratory compromise early, especially given the recent anesthesia and immobility. Although the patient isn't on any supplemental oxygen in this case, this action will ensure an ongoing assessment of their oxygen status, which is also a critical step, especially during the immediate post-operative period. Now, this is indicated because this will again ensure the adequate oxygenation. It will also identify possible complications such as atelectasis or maybe pulmonary embolism. Now, what about the second one? Position the operative leg flat on the mattress. Is this going to be indicated, contraindicated, or non-essential? This is contraindicated because post-ORIF elevation of the post-op extremity is typically recommended. This is done to reduce the swelling, to promote venous return, unless contraindicated by the surgeon's orders, but it is not specified in this case. And the reason why we keep the leg elevated, again, is to reduce swelling and edema. Now, since it is saying otherwise, this can increase pressure on the surgical site. It can increase the swelling. This will also compromise the circulation. It will compromise the healing process. So this client may be at risk for compartment syndrome. Now, what about the third nursing action? It states, check the operative foot's neurovascular status. This is something that is indicated because we're supposed to be doing frequent neurovascular checks. We're going to look for the sensation, assess for the pulses, the movement, the color of the skin, the temperature of the skin. These are all critical after any extremity surgery like this one to detect complications such as vascular compromise, or it could be compartment syndrome or possible nerve injury. And the bulky dressing and the splint may mask early signs, so we definitely need to make regular monitoring this time. All right, let's have number 4. Offer fluids and light snacks if no nausea. The answer here is indicated, because after surgery, encouraging oral intake if tolerated. If the client's gag reflex has already returned, this is going to help maintain the client's hydration and nutrition, especially since the patient is receiving the IV fluids and has stable vital signs. Now, no nausea, there's no other contraindications mentioned in the scenario like bowel surgery, and so this is quite appropriate in this case. Now, what about the 5th one? It says place a urinary catheter to monitor fluid balance. This is non-essential because the patient is stable. There's no evidence of fluid overload, renal issues, or inability to void. And also the client's having IV fluids at a maintenance rate of mLs per hour. There's vital signs are normal. And remember about the catheter that is invasive, it will increase the client's infection risk. So this is unnecessary unless it is ordered or there is a necessity. There is a clinical need for this urinary catheter placement. Now, what about the 6th one? It says, provide pain medication PRN as ordered. Well, our client is post-surgical, right? And of course, pain is expected, so that is going to be indicated. And the administration of pain med here is based on the patient's pain level, which is a standard. And this is a very critical intervention to promote our client's comfort and recovery. Now, let's have the next one. Keep the sequential compression device on the unaffected leg. This is also indicated. The SCDs, or what we call a sequential compression device, they're used by the patient to promote venous return and also to prevent deep vein thrombosis. We know that this is a common risk, especially for a post-op patient, and they have less mobility this time. And so if we are applying it to the unaffected leg, this is also an appropriate action. Let's have the last one, which is start discharge education. This is going to be indicated as well because even during the early post-op phase, when we initiate the discharge education, which should include mobility restrictions, wound care, or maybe medication use, these are all appropriate in order for us to prepare the patient and their family gradually. It doesn't mean discharge is imminent, but this action aligns with the proactive care planning. Even during admission, we can already start the discharge process, I should say. Now, for this test question, I want you to prioritize patient safety here. You have to eliminate those harmful actions. So ask yourself, when you read each nursing action, ask yourself, could this action cause harm based on the scenario? And then if it is a yes, then of course it is contraindicated. And so, for example, positioning the leg flat could worsen the swelling. So this is a harmful intervention. Another thing that you need to remember when you're dealing with a post-op patient like this, always assess for the ABCs, airway, breathing, and circulation. So most of these actions that support airway, breathing, circulations are often indicated. And these include monitoring O2 saturation, checking neurovascular status. These are going to align with the circulation and breathing priorities. Another thing that you need to do in this question is to consider the timing and the context. So you have to ask yourself, is this action appropriate at this stage of care? And especially that we have the start discharge education, this is quite a reasonable action even at the time of admission. But the insertion of a catheter like this one to monitor fluid balance, this might be premature or unnecessary without any specific indications, especially that there are no evidences that are mentioned in the case scenario that will support the need for a urinary catheter insertion. Another thing that you need to use here is to utilize the Maslow's hierarchy of needs. Again, we start with the physiological needs, deal with the pain management, oxygenation, circulation, and we are going to also offer pain medication, neurovascular checks to address the immediate needs. And do not forget to look for the clues in the scenario. This is a very important step because stable vital signs and there's no mention of complications. This will definitely guide in deciding which actions are indicated, contraindicated, or non-essential. Now, don't forget to apply the standard post-op care principles as well. We are going to focus on pain management, monitoring for complications, and these are your neurovascular status, oxygenation, and DVT prevention. So these are your priorities in this type of case.
Before moving ahead, here's something you need to hear if you're feeling anxious about passing the NCLEX, especially if you're aiming to do it in 1 week or 1 month, then our complete online NCLEX review crash course is your answer. This is your shortcut to success, a tried and tested course with a 99% passing rate. More than 5,000 students have achieved their NCLEX goals using this course, and now it's your turn. Here's what's included. 100-hour animated mini crash course, perfect for last-minute preparation to pass in just 1 week. 300-hour comprehensive lectures covering 300 high-yield topics that the NCLEX loves to test. 5,000 real NCLEX questions. Train with real exam-style questions and be prepared for anything. 15 full-length practice tests, including CAT simulation. Build your confidence with realistic exam experiences. Exclusive NCLEX ebook and 1-year access. Study whenever you need without restrictions. Don't let this opportunity slip away. Enroll now at 70% off. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's jump into the topic.
Let's have the next one here. This morning, a 27-year-old patient arrived at the acute care medical ward complaining of severe pain rated at 9 out of 10 on the standard scale, along with an irritating, persistent dry cough and a profound lack of energy. Diagnosed with a sickle cell crisis, the nurse is formulating a care plan after the scheduled shift assessment. Your task here is to identify those nursing actions that should be included in the client's care plan. So let's take a look here. This is basically a select all that apply. So the first nursing action states, keep the room temperature cooler than 72%. Do you think this is going to be included in the care plan? Well, at first glance, you might think that a cooler temperature, or especially a room, could help with the comfort, but it's not a priority in sickle cell crisis. because there is no evidence in sickle cell care guidelines, especially from NIH, that says a specific room temperature below 72 degrees Fahrenheit improves outcomes. Actually, with sickle cell patients, they are often sensitive to cold because it can cause vasoconstriction, which might make vasoocclusion worse. It will increase sickling, potentially leading to more pain. And the scenario that we are having here focuses on severe pain, and none of those symptoms are related to the room temperature. And there also no mention of patient feeling hot or uncomfortable with the temperature. So this intervention doesn't address the main issue. And we're better off focusing on things like pain management or maybe oxygenation or dehydration, which will directly tackle the pathophysiology of sickle cell crisis and should align with the goal of care here. So we are not going to check off on that one. Now, let's have the second one. Administer pain medication following agency or provider orders. Well, this is correct because the sickle cell crisis causes vasoocclusion, wherein those sickled red blood cells can block the blood vessels. This can lead to ischemia and with really intense pain. And here in this case, the client is complaining about 9 out of 10, which is actually severe. And giving the pain medications as ordered, like this opioid, can help manage the pain. It will reduce the patient's distress and make them more comfortable, and also help their physiological stability, because uncontrolled pain can cause stress responses like a faster heart rate, which might make the crisis worse. And this fits right into the Maslow's hierarchy, since the pain is a basic physiological need that we need to address first. And it's also a key part of evidence-based care for the sickle cell crisis. Now, what about the third one? It says check peripheral pulses hourly or as directed by the institutional or provider orders. Also correct. It's because in sickle cell crisis, vasoocclusion can reduce blood flow to the extremities, which might lead to tissue ischemia or even infarction if it gets bad enough. And so when we are checking the pulses, let's say radial or dorsalis pedis pulses, then we can assess the perfusion and catch early signs of complications, like if the pulses are weak or absent. And this is also critical because poor circulation can cause serious complications like tissue necrosis, and we want to act fast if we see that something is happening. And this action also ties into the airway breathing circulation modality, since we're focusing on the circulation. And yeah, do not neglect this. What about the fourth one? It says position the patient with the head of the bed constantly elevated. This is also included because the patient has a dry cough and is really fatigued, which can point to hypoxia or even acute chest syndrome, which is a serious complication in sickle cell crisis wherein the blood vessels in the lungs get blocked, and this is going to affect the gas exchange. And so when we are elevating the head of the bed, this is going to help with the lung expansion. It's going to make their breathing easier, and it will also improve their oxygenation by enhancing their ventilation perfusion matching. And this is critically important since the respiratory issues can escalate quickly in this client with a sickle cell crisis. And again, it is also going to align with the ABC's prioritization. Now let's have the next one. It says promote oral fluid intake and continue IV saline per facility or provider orders. This is also correct because this is going to prevent the blood viscosity in sickle cell crisis. We know that there is hemoconcentration in this issue. And with this, we are preventing the sickling and further vasoocclusion. And so the key here is that hydration, whether through oral fluids or IV isotonic saline, this can help reduce that viscosity. It will improve microcirculation and it will prevent further sickling. And this intervention is also part of the standard care for the sickle cell crisis because it keeps the patient hemodynamically stable. It will lower the risk of complications like organ ischemia. Let's have the next one. It says administer oxygen therapy PRN as ordered. This is also included because the patient's cough and fatigue suggest they might be hypoxic, meaning they're not getting enough oxygen either because the sickled cells are not delivering oxygen well into the tissues or because they're starting to develop acute chest syndrome. And if their oxygen saturation drops below 95%, giving the client oxygen can boost their oxygen in their bloodstream. It will improve tissue oxygenation and will also ease symptoms like fatigue. And don't forget, guys, oxygenation is one of the key actions that we should be doing in a cell crisis to prevent complications. Now let's have the next one. Monitor oxygen saturation hourly or per facility or provider orders. This is also indicated, right? With the use of that pulse oximeter to check oxygen levels regularly is done to catch hypoxemia, especially since the patient's cough and fatigue are already red flags for potential respiratory issues. And if their saturation drops, we can intervene quickly, maybe with oxygen therapy or by notifying the provider, and definitely doing hourly checks or whatever protocol says will help ensure we're staying on top of their respiratory status, which can change really fast, especially that they have the sickle cell crisis. Let's have the next one. Assess capillary refill hourly or according to facility or provider orders. The answer to this is also, we are going to include this because cap refill time can tell us about peripheral perfusion, basically how well the blood is getting to the extremities. And we know that in sickle cell crisis, vaso-occlusion can slow down the blood flow. And if cap refill takes longer than 2 seconds, it might mean perfusion is getting worse and increasing the risk of tissue ischemia. Let's have the last one. It says strictly monitor and document fluid intake and output. The answer to this is also, we're going to include this one because with sickle cell crisis, dehydration can make the blood thicker, which promotes more sickling, and this can worsen vaso-occlusion. And so if we are strictly monitoring all their fluid and intake, this is going to make sure the patient stays well hydrated. So we will know for sure if the client is not getting enough hydration. And this can also help us in checking kidney function, since sickle cell crisis can cause microvascular occlusion in the kidneys, which will, it can lead to decreased urine output. And so accurate documentation can also help us spot the imbalances early on, like if the patient is not producing enough urine. And so we can adjust their care and prevent dehydration-related complications. And so I hope that you were able to catch on to the different rationals that we have. So please don't forget to use the AdPi in this test question. Remember that this is basically formulation of this client's care plan. So you're going to select those interventions that address the assessed needs and also to prevent complications. Now, do not forget to prioritize using the ABCs, supporting interventions that support the airway, the breathing, and the circulation. And again, these are our core elements in the care of a client with a sickle cell crisis. Now, don't forget to use your knowledge about what you've learned about pathophysiology, right? Also eliminate those distractors. So rule out those options not directly supported by the scenario or standard care for the diagnosis, such as keeping the room temperature cooler than 72%. This is a distractor. This is all unrelated to pain, unrelated to the cough or fatigue, and it's not a priority in sickle cell guidelines as well. And do not forget to remember about the standard protocols about the condition. Again, you must recall the evidence-based care for the sickle cell crisis. We're going to deal with pain management, hydration, oxygenation, and monitoring.
Before we move ahead, here's something you shouldn't miss. If your goal is to pass the NCLEX in just 1 week or 1 month, then the fastest and most effective way is to enroll in our complete online NCLEX review crash course. This course is a one-stop solution, a reliable shortcut, and a proven method with a solid 99% passing rate. More than 5,000 students have successfully passed the NCLEX by using this course. Here's exactly what you'll get. 100-hour mini crash course perfect for those who want to pass within a week. 300-hour comprehensive lectures covering 300 essential NCLEX topics that are commonly tested. 5,000 real NCLEX questions. Prepare with real exam questions and eliminate surprises. 15 full practice tests, including CAT simulations, simulate the real exam for a stress-free experience. Exclusive ebook plus 1-year access. Study whenever and wherever you want. Seats are filling up quickly. Enroll now to save 70%. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's continue with the topic.
Let's have our next item. The nurse examines the admission records and lab results from the emergency department for a 24-year-old prima gravida who was hospitalized earlier this morning. Highlight the critical findings in the nurse's notes and lab profiles that require the nurse's immediate attention. So we have here basically progress notes and some blood test results. So it states at 10:45 in the morning, a 26-week pregnant prima gravida arrived at the emergency department reporting a severe headache and blurred vision that had persisted since the previous morning. She stated that she took acetaminophen without relief. Although resting provided slight improvement, she continued to seek relief and was concerned about her baby's well-being. On examination, she appeared anxious with a current weight of 148 pounds, 67.27 kilos, and a height of 60 inches. Her prenatal record from 1 week ago notes a weight of 140 pounds or 63.5 kilos. Her skin was warm and dry, and she had 1+ edema in the lower extremities. Her vital signs were as follows: blood pressure 142/104, heart rate 94 beats per minute, respirations 18, temperature 97.3, 36.3 degrees centigrade, saturation of oxygen 96% on room air. She denied experiencing respiratory distress. Her current medications include prenatal vitamins. So again, your task here is to highlight those findings that require immediate attention. All right, pay attention right now. The first phrase that you're supposed to highlight here is the 26-week pregnant prima gravida. Why? Well, this means the client is 26 weeks pregnant with their first baby. The phrase alone, it's not a problem, but it's important because preeclampsia often starts after 20 weeks. And take note that this is a first-time mom, and they are at higher risk for this one. And so you as a nurse working for this client should watch this client carefully for any signs of preeclampsia, such as high blood pressure or possibly swelling, to keep this mother and baby safe. Now, what else we have to highlight here? This is also going to need severe headache and blurred vision. And why is that? Yeah, that's a bad headache, right? This is something that she stated it persisted. It didn't go away with acetaminophen. And their vision is also getting blurry. And that is a warning sign in this pregnancy. Now remember that the client is in their 26 weeks of pregnancy. These symptoms could mean that preeclampsia is already going on, and this is affecting the client's brain, and this can lead to seizures. Now we call that as eclampsia, or possibly can lead to stroke. And these symptoms are also urgent because they show the mom's condition could get worse quickly. So you as a nurse working for this client, you have to act fast to protect both the mother and the baby. Now, another thing that you need to highlight here is the client's weight of 148 pounds. Compare it to the previous weight on the past week of 140 pounds. That is quite significant, right? Well, their weight is up by 8 pounds in just 1 week, which is a big red flag. And remember, in pregnancy, gaining more than 2 pounds per week at 26 weeks can mean the body is holding onto too much fluid, which is a common sign of preeclampsia. And this reflects rapid weight gain along with high blood pressure. There is also edema, there's headache, there's blurred vision. So this is going to make it even more likely that preeclampsia is really happening in this client. And you as a nurse should act fast because this much fluid buildup can lead to serious problems for the mother, like elevation of the elevation of the blood pressure. Another thing that you need to highlight here is the edema of 1+ in the lower extremities. Even though this is considered mild swelling, and this is also considered normal in pregnancy because of the known extra pressure on the veins. But here is the big but. When there is 1+ edema in the lower extremities, and when it is seen together with the high blood pressure and other manifestations, then this could be a sign of preeclampsia. So you should watch for the worsening of the swelling, like if it moves to the face or the hands, because that would mean the condition is getting more serious. Again, once the manifestation is part of the cluster, then that is concerning. Now, what else we have to highlight here? This is going to include the blood pressure of 142/104. This blood pressure is too high in pregnancy. In pregnancy, it is expected that the blood pressure would be higher, about less than 140 or less than 90 in the diastolic. Now, at 26 weeks, high blood pressure is a big red flag for preeclampsia, especially with the symptoms that the client is already experiencing. We know that this can harm both the mother and the baby. This can also cause bleeding in the placenta, and this can hurt the baby by reducing perfusion, oxygen supply to the baby. Now, let's look into the lab results here. What do you think would be the labs that need to be highlighted? So, looking into the alanine transaminase of 40 units per liter, that's more than the usual value 4 to 36 units per liter. Yes, we are highlighting that as well because this means the liver might be stressed. And remember that in preeclampsia, the liver can get damaged because it's not getting enough blood flow. And this isn't just a huge increase, but it is a warning sign, especially with the other symptoms showing up for this client. So you're going to keep checking, monitoring this patient's liver tests to make sure it doesn't get worse, because this can lead to a serious HELLP syndrome. Remember about that HELLP syndrome? Yes, do not forget about that. Now, what else do we have to highlight in the lab test here? Another is the aspartate transaminase. The normal values is set at 0 to 3 to 35 units per liter, and the client's value is way above. And it's also showing the liver might be having trouble as well. And in pregnancy, the liver enzyme values are usually lower. So in this case, even a small increase is already concerning. And this also is an evidence that the client's preeclampsia is already affecting the liver function. Again, you're going to watch this client for any issues like thrombocytopenia to catch for the HELLP syndrome early. Now, what else do we need to highlight? We have the blood urea nitrogen of 32 milligrams per deciliter. this is too high, which means the kidneys are not working well. And our reference range, we have 7 to 20 milligrams per deciliter. And again, if there is a high BUN, this can happen in preeclampsia because the kidneys don't get enough blood flow. And this is serious. You have to act quickly, notify the medical provider right away in order to protect the client's kidneys. What about the creatinine? 1.4 milligrams per deciliter. Yes, that's also part of our issues. This value is already elevated. There is already some compromise into the kidney function. And this means that there's already an ongoing damage to the kidneys because of the poor perfusion to the kidneys. And you need to take action right away to prevent this from worsening. Now, what else? We have urine protein of 30 milligrams per deciliter, which is higher than the range of more or less likely less than 15 milligrams per deciliter. So that's also one of our answers. This is a key sign of preeclampsia because it shows the kidneys are leaking protein due to the damage. And using this assessment finding along with the hypertensive, blood pressure, and the other manifestations, this makes the situation much more urgent. So again, act fast now to prevent more issues for this client and her baby. So do not forget to synthesize all these abnormal findings. We have the high blood pressure, we have the proteinuria, we have the elevation of the creatinine, blood urea nitrogen, the AST, ALT. These are our key signs that the client has now decreased perfusion to the renal system or the kidneys itself and the liver. Now, another test taking strategy for you to use here is to ask yourself if there is significant weight change here, especially that the client had weight taken about a week ago. And again, that is quite an increase right there. And so you have to make sure that you have to keep attention to those issues, the pressing issues that will affect the client's safety. And again, remember about the client's circulation, breathing, and airway, since we have a problem with tissue perfusion in this preeclampsia. And the client is already complaining about that headache that is not really going away even using an acetaminophen. Remember that this is already a sign that she is not getting enough perfusion even to the brain, right? Blurring of vision, severe headache. So that's a red flag right there. Now, also, you got to look for the patterns and the cluster of symptoms. You have to look for the patterns that match a specific condition, especially the client is already having the preeclampsia. Do not forget about the definition of what preeclampsia is. This is the blood pressure of more or less 140 over 90 mmHg, and also that the problem can occur after 20 weeks of gestation. There's that proteinuria, a headache, the vision changes, the organ dysfunction as evidenced by the AST, ALT elevation, and the BUN creatinine, urine protein. Those are definitely supporting evidences. Now, do not also neglect differentiating between the normal versus abnormal findings in pregnancy, such as the mild edema. This can be normal. However, this is already significant because of the other changes that are happening to this client. And again, these are subtle manifestations that you might neglect in this type of item. So, and in order for you to successfully answer this item, you have to consider the context of the pregnancy and the gestational age itself. Again, with this age at 26-week gestation, the client is in the second trimester, wherein the preeclampsia can develop. And our patient is at a higher risk. They are prima gravida. And also the rapid weight gain. That is already a red flag. So you want to make sure to highlight all these findings and think about the manifestations that require immediate action. All right, you have your kidney function abnormalities, the blood pressure that's elevated, and also the neurological manifestations. Those are huge issues that you need to address this time. Alrighty, so I hope that you are learning from this session. You got to take a moment to reflect on what you've learned, practice those scenarios, and keep building that nursing knowledge. You're so close to your goal. Now, if you found this video helpful, please like and subscribe for more NCLEX prep content. Let us know in the comments what topics you would like to see next, and we'll catch you in the next video. And say again, thank you for watching this session.